Bismillah ar-Rahman ar-Rahim. Good morning and hello my friends and hello my colleagues and my fans and good morning everybody. Today I will talk about an important issue, which is the brain in systemic disease. We all know that the brain is a part of the human body, and the brain is in continuous reaction with the rest of the body. And it comes next to the heart as the second most important organ in the human body. So we have to understand how does the brain interact with the body in health and disease. Any systemic disease can affect the brain, and any brain disease can affect the body in the opposite way. So there is a continuous interaction between the body or the different organ systems and the brain. Take care of the body in different clinical conditions, and when the body is ill, the heart, the kidney, the liver, the gastrointestinal tract, the genitourinary system, the skin, any organ of the body, take care of the body and the brain will take care of itself. This is a basic rule in clinical medicine, because the brain has its special auto-regulatory mechanisms, what we call auto-regulatory mechanisms, as regards the cerebral circulation, as regards the neuromodulation, and as regards the different neural mechanisms playing a role in the maintaining the biochemistry and the functions of the brain. And its, of course, coverings. And we have an important part of the brain which is called the blood-brain barrier, which plays an important role in the homeostasis of the brain in response to different events in the human body, in health and in disease. The blood-brain barrier, which separates between the systemic circulation and the brain. And the cerebral circulation is in continuous harmony with what happens in the systemic circulation. So there is an interaction between the brain and the body. The brain might be affected by many local diseases, or it might be affected by systemic diseases. How does the systemic disease affect the human brain? It can affect the human brain by many mechanisms, either by metabolic molecules or different cytokines and metabolites which might affect the brain, or through what we call systemic inflammation. And this is what we call the inflammatory response of the brain to systemic diseases, or the inflammatory manifestations of systemic diseases in the brain. Inflammatory manifestations of systemic diseases in the brain. As regards the effects of whether it is by molecules or metabolic, I mean by metabolites and different molecules and cytokines and etc., which are produced due to systemic disease and then secondly affect the brain, or it is whether it is due to systemic inflammation or as a part of inflammatory response due to a systemic disease, there will be what we call features of encephalopathy. And encephalopathy, it is a collective descriptive term which refers to a group of clinical manifestations due to diffuse affection of the brain substance, by some pathological process which disturbs its function or structure or both. When there is diffuse affection of the brain substance by some pathological process disturbing its function or disturbing its structure, that is the function of the brain or the structure of the brain, or both, the two together, there will be, this is what we call the encephalopathy. And encephalopathy is different from encephalitis. Encephalitis means inflammation of the brain substance, which might be traumatic or might be immune mediated or might be infective due to infection. as what happens in bacterial encephalitis, or more commonly viral encephalitis, or other microbial agents and infectious agents like parasites, like fungal infections, which affect the brain substance and cause infectious encephalitis. So infectious encephalitis is one of the causes of encephalitis, but encephalitis can be due to other causes like autoimmune encephalitis in autoimmune diseases which affect the brain, and also it might be traumatic encephalitis or toxic encephalitis due to toxins and chemicals entering the body. So encephalitis means inflammation of the brain substance, but encephalopathy means group of clinical manifestations due to diffuse affection of the brain substance as a result of a pathological process which affects structure or function of the brain, or both structure and function. The most common causes of encephalopathy, they can be due to, for example, we have the encephalopathy that is disturbance of the function and plus or minus the structure of the brain by vascular process, like what happens in hypertensive encephalopathy, for example. And hypertensive encephalopathy, there is hemorrhages and there is edema in the brain substance due to acute sudden rise of blood pressure to high levels, which exceeds the autoregulatory capacity of the brain, and so it will result in cerebral edema and small hemorrhages, which produce the manifestations of what we call hypertensive encephalopathy, which is an hypertensive emergency or urgency or an acute hypertensive medical condition, which needs urgent treatment to avoid further progression and development of any cerebral hemorrhage or cerebrovascular stroke, which is a devastating life threat. So hypertensive encephalopathy is an example of vascular encephalopathy of the brain due to hypertension. It's met with as a complication of systemic hypertension. So hypertensive encephalopathy is a vascular encephalopathy. It's a vascular encephalopathy. We have also encephalopathy due to trauma in patients sustaining head trauma as a part of body trauma in road traffic accidents or in catastrophes. So also encephalopathy might be traumatic or post-traumatic. Encephalopathy might be also toxic and drug-related in response to certain drugs, like what happens in salicylate overdose, for example, especially in children. So toxins and drugs can produce encephalopathy. Also, encephalopathy can be due to metabolic causes, and this is commonly met with in clinical practice, and this is one of the common causes of encephalopathy, the metabolic encephalopathy. And here the metabolic encephalopathy, like the encephalopathy we see in patients with organ failure, in patients with hepatic failure, acute hepatic encephalopathy, chronic hepatic encephalopathy, acute on chronic hepatic encephalopathy due to liver cell failure, in chronic liver cell failure, and in acute or chronic liver cell failure, and in fulminant hepatic failure due to destruction and damage of the liver acutely. So the destruction of the liver and damage of the liver will affect the brain due to impairment of body metabolism and release of toxins and toxic metabolites which affect the brain directly. So this is an example of metabolic encephalopathy due to organ failure, liver cell failure, hepatic encephalopathy. Number 2, in uremia, or in patients with chronic kidney disease ending in chronic renal failure, we get another encephalopathy, we call it uremic encephalopathy, or the encephalopathy of chronic renal failure. Also in patients with pulmonary disease and pulmonary or respiratory failure, we get hypoxic encephalopathy in patients with hypoxic respiratory failure. So here we have what we call hypoxic encephalopathy in patients with end-stage lung disease and respiratory failure. So this is organ failure or major organ failure causing the brain to react and to show manifestations, and this group of manifestations we call it encephalopathy. This is the metabolic encephalopathy due to organ failure. And also we have the encephalopathy due to disturbances or electrolyte disturbances, like in patients with sodium balance disorders, hyponatremia and hypernatremia. So the encephalopathy of hyponatremia and hypernatremia and the wrong management of hyponatremia and hypernatremia itself might cause also encephalopathy. So electrolyte disturbance, especially hypokalemia, hyperkalemia, hyponatremia, hypernatremia. These also disturbances in calcium metabolism, calcium phosphorus metabolism also will disturb the brain. So electrolyte disturbances also, they might be cause of metabolic or encephalopathy. Also, patients with blood sugar disturbances, hyperglycemia and hypoglycemia. So glucose disturbances can cause especially the hypoglycemia, of course, or rapid lowering of hyperglycemia. They can disturb the brain function and produce manifestations of encephalopathy. So these are all endocrine, metabolic, toxic, electrolytes, organ failure. These are all causes of encephalopathy, in addition, as I mentioned, to the autoimmune causes, in addition to traumatic, in addition to vascular causes. These are all causes of encephalopathy. And encephalopathy manifestations, usually they present with headache, they present with disturbance or disordered level of consciousness. The patient gets confused. The patient in advanced cases might get or might sink into coma. So the obtundation of the level of consciousness, the mental dullness and confusion up to development of a state of coma. These are the commonest presentation of encephalopathy. Other encephalopathy manifestations are motor or sensory manifestations, cognitive dysfunction, that is disturbances in memory and in language and in orientation and in perception, which are higher brain functions. So disturbance of these functions and cognitive dysfunction may be one of the features of encephalopathy. Also convulsions might be one of the features of encephalopathy, and I mentioned these in seizure disorders, convulsions. Also motor and sensory manifestations affecting the body. So these are all collectively, we call them encephalopathy manifestations. And here shows us how the brain reacts to systemic disease through encephalopathy. Another issue is the issue of what we call the inflammatory manifestations of systemic diseases in the brain. And this is exemplified by four main mechanisms. Number one, the involvement of the brain in rheumatological and collagen vascular immune diseases, like what happens in patients, with Sjogren syndrome, with systemic lupus erythematosus, patients with rheumatoid disease, although rarely, patients with sarcoidosis, patients with Behçet's disease. We have what we call neuro-Behçet, we have what we call neurosarcoidosis. These are autoimmune diseases which also involve the blood vessels, especially the small and medium-sized vessels, and they might affect the brain by many mechanisms, usually through cytokine-mediated, four main mechanisms, cytokine-mediated mechanisms or antibody-mediated demyelination, or through granuloma formation, or through immune cell infiltration, or through what we call T-cell dependent cytotoxicity, or through immune-mediated vasculitis. These are all mechanisms which play a role in the response of the brain to a systemic inflammatory process in such diseases, in rheumatologic diseases or in collagen vascular diseases, which are autoimmune diseases, which they might involve the brain either through affection of the brain substance itself, what we call cerebritis, or through affection of the brain vessels, usually the medium and small vessels of the brain, that is the cerebral arterioles and the capillaries and small arteries, affected by vasculitic process. So through infiltration of the cerebrum of the brain, that is the substance of the brain itself, or through a vascular pathology. The two together, they will ultimately affect the brain, the cerebral vasculitis and the cerebritis. And this exemplified, for example, by lupus. In lupus, we get lupus erythematosus. It is an autoimmune collagen vascular disease with multisystemic involvement. It might involve, in addition to the joint manifestations and the skin manifestations, and its manifestations in the lung, in the heart, in the hematologic system, and the joints, and they might also involve the kidneys, of course, the renal lupus. They might also involve the brain, what we call cerebral lupus or lupus cerebritis, through affection of the small vessels and through the immune damage of the brain substance itself. So this is cerebral lupus. So lupus is commonly involved as a part of a systemic inflammatory response. So lupus cerebritis and lupus vasculitis of the brain. So this is a common example. Another example in Sjogren's disease, which is also a collagen vascular disease in patients with mixed connective tissue disease, or what we call overlap syndrome, with multiple features of multiple rheumatologic disorders. Most commonly scleroderma, lupus, and dermatomyositis or polymyositis. Also involvement of the brain in patients with Behçet's disease, which is an autoimmune also disease with vasculitis affecting the medium and small size vessels, usually present first with oral and genital ulcerations, but Behçet's disease might involve other organs also, apart from ulcers in the mouth and on the genital organs, in the vulva in females, and on the penis in males, and the scrotum. There is genital ulcers in the mouth and recurrent, but they might also extend to involve other organs, being a systemic disease with an immune basis, causing affection of the gut, affection of the joints, affection of the CNS, causing what we call neuro-Behçet's disease. Also in sarcoidosis, which is another systemic disease, immune mediated, with granulomatous infiltration, which is non-caseating granulomas involving different organs in the body. And this chronic granulomatous inflammation might also involve the brain. Sarcoidosis can affect any organ, starting from the lungs, the mediastinum, the liver, the kidney, the pancreas, the skin, the lymph nodes, and then in progressive cases, it might also involve the brain. And here we have what we call neurosarcoidosis, what we call the entity of neurosarcoidosis, that is affection of the brain by granulomatous inflammations and infiltrating granulomas in the brain substance, which are non-caseating. As we all know, it's a non-caseating chronic granulomatous inflammation in the brain with granuloma formation. It is a granulomatous disease. Same what happens as being a cause of granulomatous liver disease. Here we can get granulomatous brain disease, complicating sarcoidosis also. So the neurosarcoidosis, it is a type of a systemic response or inflammatory response to a systemic disease, which is autoimmune or is immune mediated. Also, the brain is involved in other, as a part of systemic inflammation, as a part of what we call post-viral syndrome. Post-viral syndromes related to infection with viruses. Number 3, also in relation to, or inflammation in relation to some therapeutic medications, especially the biologics which are currently used in the treatment of many chronic diseases. These biologics might disturb the brain, and one of its side effects, they might also cause a sort of inflammatory problems in the brain. So inflammatory manifestations related to therapeutic medications. This is another important mechanism. And then we have the involvement of the brain as a fourth category, or the fourth category of brain involvement due to systemic disease, in relation to what we call autoimmunity resulting or autoimmune diseases resulting from or in the concurrence of what we call immunodeficiency syndromes. So the autoimmune reactions in the brain related to immunodeficiency syndromes, this is another group of conditions of inflammatory brain disease related to systemic problems. So the reaction of the brain to rheumatologic diseases and the collagen vascular diseases, the reaction of the brain in post-viral states, the reaction of the brain to therapeutic medications, the reaction of the brain in autoimmune disease complicating or resulting from immunodeficiency syndromes, of all its types, the hereditary and acquired. These are all the categories of brain disease in relation to systemic disease. Thank you so much, and I will see you in my other further episodes. This is about the brain and the body, or the brain in systemic diseases.